I took part in the first ever Health Day in December, which was fantastic. Kudos to those who put that together. I know there was an awful lot of hard work that went into that, but it was such an enlightening day. And for those that I spoke to who were in the audience, who were participating, a really, really valuable day. So thank you. And that takes us on to today, Excellencies, ladies and gentlemen. A couple of months ago here in the UAE, the world finally woke up to what is a sobering reality, that climate change is one of the greatest threats to human health, our health, in the 21st century. And to quote the head of the WHO, and many of you in this room will be well aware of this, he said that for too long health has been a footnote in climate discussions. Well, at COP28, under the presidency of the UAE, of course, our health was finally placed at the heart of climate action. The COP28 UAE Declaration of Climate and Health, which was endorsed, as I understand it, by 148 countries. 149 countries. I stand corrected. So that puts us up, most of the countries around the world, recognise the urgent need to protect human health and to invest in a more resilient health system everywhere. And to that end, stakeholders in the UAE at COP, including governments, development banks and philanthropists, collectively announced commitments of more than $1 billion towards tackling the climate health crisis. That nexus is so clear now. $1 billion is a really good start, but it is nowhere near enough. But it is a good start. So how do we translate what was this incredible sort of political position with a financial commitment into tangible action to ensure that the work in Dubai that was achieved has real, lasting legacy? Our panelists today, Mkhumbizi Kandodo Chimponda, who is the Minister of Health of Malawi. You were one of the country champions for the COP28 climate and health process. Congratulations. I know that you worked really hard on that, and you were, the work is hugely acknowledged. So congratulations on that. A number of other people in this room also keenly involved in what happened in Dubai. A.J. Tandon is the lead economist at the World Bank. Peter Sands is the executive director of the Global Fund. And Naina Batra is CEO at the Asian Venture Philanthropy Network, AVPN. I've had the absolute pleasure of spending some time with Naina, not just here, but in Davos last month, where we talked about philanthropy and the nexus between business and philanthropy, and how more can be done and what needs to change. And I know that you've got a real keen interest in how we can sort of ensure that this climate health nexus gets attention. So I'm looking forward to this discussion. Like I say, I'll open the floor. Please, your experts are here. Let's do as much as we can today. Before we do that, though, I do want to just welcome Adnan Amin to the stage, CEO, COP28. The job goes on, sir. I just give the floor to you for just a couple of minutes for an introduction. Please, yeah.
Thank you very much, Becky. I've known Becky for a while, and there are two certainties. She's going to pass a subliminal message at the beginning telling you not to talk too long, because we want to have a discussion, which I absolutely agree with. And secondly, she's taken all the numbers that were in my speech, so I won't read out my speech to you, but maybe just talk about the issue. And when we started preparing for COP28, it was a kind of unprecedented context. It was the first ever global stocktake. The Paris Agreement had been historical. That was 7 years ago. It established a roadmap. This was a reality check of what the Paris Agreement was able to do, whether it had succeeded, where the gaps were, and what the next 5 years of climate action would look like, coming out of a global stocktake decision here in Dubai. A very tall order. It was unprecedented. We didn't have experience that had happened before. We had to really innovate around this process and create a process that was inclusive, that relied on listening to all parties, countries, NGOs, civil society, business, philanthropy, and all actors who were involved in the climate discussion, really to understand what an outcome could look like. At the end of the day, we had a very hard negotiation on the GST outcome. The reason climate negotiations are so important is not just because it's an esoteric environmental issue anymore. Decisions that happen as a result of the climate process have real implications for real-world economies in terms of directions of investment, signals for investment, who are going to be potentially winners or losers in a new climate economy of the future, what the direction of technology and innovation is going to be. So it's very high stakes politically. And I think we were very grateful that we were able to achieve the outcome that we did, mentioning for the first time fossil fuels in the body of a climate decision. In the 30-year history of the COP, that was the first time. Everybody talks about it. And every politician comes and tells you how they want to phase out. They don't tell you how. They don't tell you the fact that many of their countries are also producing and don't have an option, but they want you to phase out. So we were successful in creating a kind of political framework that allowed this momentum to happen, bearing in mind that this next 5 years, in terms of the decarbonization we need to achieve, is going to be critical to whether we achieve the 1.5 target or not as a global community. And the implications of not reaching that are massive. So, very important outcome. But the other part of the COP, which has become increasingly important, and for us, which we really prioritized, is the action agenda. The presidential action agenda is how do we bring real-world actors into the climate discussion in a meaningful way, knowing that they are the ones who are actually going to have to implement much of what is decided. So we created, on the basis of our fundamental principle of inclusivity, a framework that brings everybody to the table, but also a framework that begins to identify where are the key issues of climate action that need to move forward. And in this process, and through our listening and engagement, it became clear that there are a number of issues. Decarbonization, of course, was critical. Food security is emerging as a major issue. As you see, rampant food insecurity around the world. Impacts of climate change are going to be significantly important in terms of how we assure food security in the future, and developing methodologies to deal with that is going to be critical. And health. Health is that looming crisis that's emerging. We're now seeing, and you know, we have experts, we have a distinguished minister from Malawi, I'm sure she'll talk to this issue, we have Peter and others. The issue that we're seeing emerging is that the burden of impact on health from climate trends is going to be massive. We haven't come to terms with this. We're beginning to see this emerging. We know that, you know, disease vectors are changing. Impacts on both communicable and non-communicable diseases from climate impacts are huge and increasing. The impact from extreme weather events that we've begun to see around the world. I mean, just think back to last year, you had this flooding event in Pakistan, which involved 30 million people and $30 billion of losses, economic losses, but massive impact on human health. The human health part was less addressed. And we were very conscious that there is really a mismatch in terms of the direction of climate action, in terms of how it's addressing the health impacts. Bear in mind, the news of the last 2 days has been that we have, for the first time in recorded history, surpassed the 1.5 global warming average temperature last year. These are variable. Hopefully this year will be less than 1.5. But climate action has become imperative, but at the same time, addressing the risks has become imperative. Climate financing has been very under-addressed. I think 1 to 2% of climate financing goes to health. Multilateral financing for climate health is also minuscule. The scale of the challenge is important, and Peter's sitting here, so he's going to come up with the money. But the scale of the challenge is massive. Those of you, just think back, few years at the beginning of the COVID crisis. I was in New York at the time. New York has great hospitals, it has a health system, but I can tell you the palpable sense of fear that we had in that city. I was sitting in my apartment on 3rd Avenue. I had never seen deserted streets in New York before. There was news every day of overflowing hospitals. Bodies were being stored in cold storage containers. There was a real sense that the health system was unable to keep up with this. So this is a pandemic, and pandemics are managed and we move on. But what it really illustrated is the vulnerability of global health systems to mounting challenges. And one of those critical mounting challenges today is climate and health. How are we going to address this challenge? How are we going to begin to orient financing towards this? So when we went to the first World Health Assembly to put this proposition forward to the member states of the WHO early last year. And I can tell you there was absolute excitement among health ministers that finally we have a venue where this can be discussed. There was a huge outpouring of support. We created a steering committee of ministers of health from different parts of the world to start to guide this process. Together with the Director General of WHO, we started thinking of having the first ever health ministerial, climate and health ministerial at the COP, which we did. And we started the process of addressing the whole issue of financing. So we had our pledge, our declaration. 149 countries now signed up to it. That's a remarkable number of countries, and the interest is growing. The others didn't sign up because they didn't have enough engagement, but I see that coming. I see this now as a universal recognition that's going to be in place. Political will is coming together to take this forward. And we also adopted the guidelines on climate and health financing. Now, the $1 billion commitment we had at the time, in my view, is just to get the ball rolling because the scale of the challenge is immense. We really need to start thinking through national and international priorities in terms of where we are directing financing, how we are addressing real risks to health coming from climate change, and how do we deal with the fact that over the years, the incidence of impact on health is going to be massively increasing. There are some estimates that in the coming years, we will be losing 250,000 people a year to climate and health-related incidents. So it is a very serious issue. The part of the answer to this issue, there are so many institutional research and development, innovation, but a large part of this answer is how do we deal with financing, and therefore it's really my honor to be with such distinguished participants for this discussion, and I'm looking forward to hearing everything they have to say about this.
Good, thank you very much indeed. Adnan, it's an absolute pleasure to have you. Are you staying with us?
For a little while.
For a little while. Stay as long as you can. Stay as long as you can. Can I ask my panelists, my esteemed panelists, to come and join us, please? Minister of Health from Malawi, Minister Chiponda, AJ, Peter Sands, and Nina. Take your seats, if you will. I want to start with you, Minister of Health from Malawi. Minister Chiponda, Malawi is one of a number of country champions, as I suggested at the beginning of this, who really helped drive this joint action. It's a country that is experiencing the impact of climate change on health and well-being of its citizens firsthand. I hate to use this term, but you are absolutely in the crosshairs of climate change and its impact on health and well-being. Can you just explain very briefly how? What's going on?
Thank you so much. Let me really express my gratitude to the organizers for the invitation. I'm here speaking on behalf of Malawi, but also speaking on behalf of Africa, because Africa, most of our countries, especially in the SADC region, we face the same problems. So let me also take this opportunity to congratulate United Arab Emirates. Really, for the first time, health was discussed at COP28. So we are grateful, we don't take it for granted. And now, I guess the question is, what next after COP28? If I go back home, they said, okay, you are back from Dubai. We are happy you enjoyed Dubai, but what next for Malawi? What is it that you have achieved? You spend almost a week there. Can you tell us something? Because this is what we're supposed to report back. It's not just about visiting, we have to report back. So I'm happy that we're having this conversation again. So for us, for me as a minister, what I would like to see is that we're happy that we discussed health at COP28, but I would want it to be the mainstream agenda, not as a side event. Because a side event, it finishes there, a side event. What next? You want to be in the main hall. To be part of the discussion. So we would want to see that happening, and we are hoping that as they are preparing for COP29, which I know discussions start in Germany in May, I hope that will be one of the discussion. The other one, I'm so happy the Honorable here already talked about the 1 billion which was pledged, and we are so grateful for that. But then the question is, how accessible is this money? What exactly is it going to do, and where exactly is it going to be used? That is the question.
Well, let me put this to you very briefly before we move on, because Malawi faces a myriad of challenges, as do other countries in your region and beyond. High debt, rampant inflation. The list can go on. IMF funding is conditional on economic reform. In this climate, how do you ensure a commitment from any financing, a commitment to prioritise climate, health, finance? And what does that very specifically mean for your country? You are right in pointing out that this needs to not be a side issue. It needs to be on the on the main agenda. It needs to be in the plenary halls of these sort of events. But what does it look like to you in Malawi?
For us in Malawi, because when we're talking about the impact of climate change, there are several levels of the impact. For some, they're talking about how do we create a prepared health system, a climate-smart health system. To some. To Malawi, I'm talking about how do we recover from the loss and damage which has already taken place. Because we are already suffering the effects. We had the West cholera outbreak killing 1,700 only last year, affecting over 60,000 Malawians. And now even our neighbors, Zambia, Mozambique, they're also having the West cholera outbreak. These are the effects of the climate shocks we're talking about. We had the West cyclone last year, affecting almost 2 million Malawians. Some of them, they're still homeless up to now. In the health sector, I had maybe over 50 facilities, and most of them, even now, they cannot be able to provide services. These are the effects of climate change. You're talking of drought, loss of crops. These are the effects. And when you have drought, you have hunger, it means you have more malnutrition affecting the children. And you have issues like anemia. So for us, the situations, they are real. So we want to talk about loss and damage. For what has already been damaged, we need to recover from that before we even talk on how do we prepare if we get a cyclone next year. So before I get there, we need to discuss about this. So that is why, for us, it was very important that, okay, there was a pledge of 1 billion, but how exactly, what should countries do? Last week we had a meeting at World Health Organization about the pandemic fund. They called for a regional meeting. There's an opportunity to apply for that fund. The fund is going to address ABCD. Countries can access this fund by applying. These are the conditions of how you apply. It was very meticulous, detailed, on what exactly you need to do. So we would want the same to say, okay, there was a pledge of 1 billion. How exactly do I access that funding? So those are the issues which we would want to get more details. But otherwise, this is a very, very good initiative. It is going to help us a lot. We need infrastructure. You need more healthcare workforce. We need a lot more. But this is at least a first step, which has to be done.
Fantastic. I mean, on the cholera line, I think there's 40 countries in Africa now currently struggling with what is a really significant cholera outbreak now. And so if anybody needs reminding, not those in this room, but if anybody needs reminding that there is a health and climate nexus, that is it. AJ, the World Bank is among the leading financiers in global health. We know that the level of public indebtedness in many countries like Malawi, in LMICs, is hampering countries' abilities to meet their very obligations on health as a human right, let alone then thinking about how you kind of prioritise how any money accessible is spent. Climate change is only going to exacerbate the issues that so many of these countries have. How do health financing systems need to adapt to both address existing challenges and absorb the added burden of climate change? And then the question is, from the esteemed minister here in Malawi, where are the funds and how do we access them?
There's a lot of questions there, but thanks very much. So yes, so somebody made the point about making climate financing health sensitive. So I'm going to take the flip side about how to make health financing climate sensitive. And I just want to reiterate the point that you've made, that let's not forget that many of our global south countries, low and lower middle income countries, are deeply underfinanced for health even today. So there's not enough resources for making progress towards universal health coverage, which is one of the SDGs, SDG 3.8. And also, whatever financing there is, it's very inequitable and very inefficient way of financing. So many low and lower middle income countries finance their health systems out of pocket spending. And out of pocket spending is a tax on the sick, right? And in that context, I just also wanted to make the point that we, together with the WHO, every 2 years we take stock of where countries are for universal health coverage, and we are off track for service coverage indicators and financial hardship from accessing healthcare. And by financial hardship, I mean this recognition that universal health coverage has, that when you fall sick, it's not just you who falls sick, it's your wallet also that falls sick, right? So, and more people are spending more than 10% of their budget when accessing healthcare. So we're off track. And then on top of that, we can think of climate change as really a risk multiplier. I think the point was already made about mortality and morbidity, but I just want to add one other dimension to this, that when you have countries where a lot of your financing is coming from out-of-pocket sources, this also pushes people into poverty, right? So we've done some work at the bank where we've estimated that about 125 million more people will be pushed into poverty due to climate change related, and of that 1/3 is really due to the climate health nexus. Through increased utilization from diseases that were already mentioned, NCDs, but also malaria and dengue and the like. So just to make that point that this is also a sort of a financial shock that needs to be taken into account, and it's already happening. And there is this perception over and over again that this is we are a hot country. And we can deal with heat, but that's not, even in hot countries, changes in the average matter. And in fact, we were doing a survey of what some countries consider is heat. I think India, it's like 40 degrees Celsius. France is 30 degrees Celsius. Britain is even lower. So even if you're a hot country, above average temperatures, and these are the poor and the vulnerable are the most exposed to these.
So AJ,
things.
you've hit the hot button issues. What's being done? What are you doing at the bank?
So the point I wanted to make is when we talk about energy transition and the demographic transition, the epidemiological transition, you also have to take into account the health financing transition. So countries need support in moving away from dependence on out-of-pocket financing towards more and more prepaid public financing, either finance out of general taxation or social health insurance, where levels of formality allow for that. So, because if you don't have that underlying basis of a well-financed health system, you're not going to be able to deal with your fundamental health problems, and then not going to be able to deal with climate change, and demographic challenges and other challenges on top of that. So one of the things that we're doing is providing support in terms of helping countries make progress towards a health financing transition, and then making those within the health system, making some of the adjustments to make those health financing interventions more climate sensitive. This can take a range of things. I think somebody was already mentioning. So if you have a system where you're contracting private providers, accrediting green facilities, giving them an incentive, already it's done in other matters, having those signals sent out if it's a hot day so that you don't expose yourself and the like. Making sure your benefits package is sensitive to climate change are some of the issues by which you can make your health financing climate sensitive, so that you're working together rather than seeing this as yet another siloed thing taking away from the core problems. And forgive me for stating the obvious, but being healthy is part of being adaptive, right? A healthy person is able to deal, as opposed to somebody who's diabetic or hypertensive or obese or things like that. So, that matters.
Yeah, some very good points. We talked about how stakeholders, including governments, development banks, and philanthropies, collectively announced these commitments of more than $1 billion towards tackling the crisis. Peter, let me bring you in here. You're executive director at the Global Fund. You are one of 4 co-conveners of what's known as the Guiding Principles for Financing Climate and Health Solutions. That was launched on Health Day alongside COP28, the Rockefeller Foundation, and the Green Climate Fund. There's some heavyweights in there. 41 entities endorsing these principles, including the UAE's Reaching the Last Mile. There is a clear sort of indication here of a commitment to protect human health from the impacts of climate change. The question is how? I mean, when you drill down, let's talk about this shared vision, if you will, and explain that. And the needs are clearly absolutely staggering. I quoted at the beginning a not insignificant sum of $1 billion. As I understand it, we are talking about a further $1 trillion in extra cost by 2050 in terms of health outcomes and the economic cost to the healthcare system. What's your perspective here?
Right. Well, first thing is, I think we have to recognize that we're behind the game. The health community is very quick to criticize the climate community for not recognizing that health was a big part of it, which is true. But the health community, if we're honest, we were also slow to see what was coming. And we were kind of distracted by COVID-19. As COVID-19 began to recede, we suddenly woke up to the fact that we had another disaster on us. And it is happening, and it is real. The experience of Mr. Chipona in Malawi, these are very tangible impacts that are happening right now and are killing people. And these aren't small things. You referenced the flooding in Pakistan. Malaria infections in Pakistan quadrupled. Far more people died of malaria as a result of that flooding than died of drowning. And the sad thing is, the malaria infections are still now a multiple of what they were before the flooding. Because once you've let an infectious disease run rampant, you then have to put it back again. And that's no small challenge. The fundamental thing underlying the principles is that we need to be clear what we're talking about and use a common language, and we need to focus particularly on the inequity aspect. Because the sad truth is that global health is already very unequal, and we saw that in COVID-19, and that climate change is going to hit the poorest hardest. So it is the people who are already at risk of diseases like malaria and cholera and TB and HIV, and who are already at risk of malnutrition, they're the ones who are going to get hit hardest by climate change. And so I think there's a real sense of urgency around the way we act. Now, the Global Fund is, for many of the poorest countries in the world, pretty well most of them, including Malawi, the largest provider of grants for health. And 71%, or about $9 billion of our funding goes to the 50 countries which are sort of the most climate vulnerable countries. The trouble is, most of that money was needed anyway, right? That money was needed for the diseases that are already impacting those countries. So it's really only on the margin that we're really able to deal with the increasing impact due to climate change. But what's been remarkable is how quickly countries are responding. We've just been through, we do grant programs on a 3-year cycle. Beginning of January, we started a new 3-year cycle. 40% of the grant requests for this new cycle included explicit references to climate adaptation efforts. So the recognition that we need to do something is out there. This is not a problem where we don't know sensible things to do. I mean, I'm sure if you asked the minister how she could spend another $10 million, she would have, she would take no time at all to give you an answer. So yes, there's lots of scientific things that we need to understand about the impact of climate change and health, but we can't wait till we have perfect answers. We've got to kind of learn while we do stuff. The other thing that I think, a couple of other things I think are really important. The most impacted countries are broke, right? They have no debt capacity. They're already in extreme distress. So we shouldn't kid ourselves that this is about lending them more money, right? If we want to save lives and if we want to make a difference quickly, I'm afraid it's grants, and that's the way it's going to be. And lots of sort of fancy solutions are just not going to help. The second is, to the minister's point, we have to do two things simultaneously. We have to be stopping people dying of the damage that is happening, and we need to be making systems stronger, and we need to be doing both. It's not one or the other. And then finally, as I say, the needs are there. We are already putting billions into the countries that are most at risk, but I can tell you we also have several billion worth of requests from countries which we are unable to fund, where they have said, we would really like to, for example, most supply chains in the hottest parts of the world have no mechanism for stopping temperatures going above 45, 48 degrees, right? They have small cold chains for things like vaccines and reagents, very small bits of their warehouses. The rest of the warehouses aren't cooled. The problem is even shelf-stable products, even basic things like antiretroviral medicines and antibiotics and things that don't need cooling, they begin to deteriorate when you get sustained temperatures of 47 degrees plus. It depends which drug you're talking about. It's a no-brainer to put in solar-powered heat minimizers. It's like an air conditioner, but it only kicks in above 40 degrees, right? And it isn't trying to make it cool, it's just stopping it, making it. We should be doing this at vast scale, because otherwise our ability to deliver life-saving medicines to people all over, not just Africa, but Pakistan, Bangladesh, northern India, many other parts of the world, is just, it's going to go. And my worry is it's going to go faster than we think. So I've probably given you more problems
No,
than
you
answers.
haven't. You've given us loads of food for thought. Thank you, Peter. I want to throw the question then to Naina. A bunch of no-brainers that Peter has just described, and has also reminded us that as much as there is some 9 billion being spent, much of that only around the edges, as far as the sort of climate and health nexus is concerned, but billions more needed, billions being requested, which isn't there. You have the Asian Venture Philanthropy Network, which is adept at building networks that diverse funders can kind of, corral around. How does what you have heard here today and what you are learning on the ground from that network, where's the ambition at this point?
Thank you. Thanks, Becky. So I think I want to address the elephant in the room straight up. I think we all understand the magnitude of the problem. We've talked about the statistics. We've talked about what is really needed and the fact that there is this huge funding gap. I I think it's really important to look at how do we address that funding gap. And that funding gap can only be addressed if we also bring in non-state actors. And if we bring in private capital and markets into it. Because when we're talking about the trillions of dollars that are needed, philanthropic capital is just not going to do it, no matter what we say or how much we try. And that's why I think AVPN is interesting, because we're a network of funders that deploy capital all the way from philanthropy to investment. I think it was phenomenal, and it's also really shocking that it took 28 COPs to actually bring health and climate together. And as you said, Peter, very eloquently, as you said, Ajay, and as you said, Minister, every sort of climate disaster has led to more health issues than not. So, even if I talk about my friend Nassar and reaching the last mile and the wonderful job that they've done about getting $1 billion committed, we need, just in Asia alone, $1 to $2 billion a year to address the health issues that are coming because of climate. So what are we trying to do? And I'll be very practical about the things that AVPN is doing. So we've launched something called a Climate Pathfinders Initiative, which is really looking at how do you bring in investment opportunities to impact investors that are looking at health solutions, that are looking at the intersectionality between climate and health. I think one of the things the pandemic did, which was surprising, is it really increased the spotlight on climate change, not really looking at the health disaster that was there. So before the pandemic, and I run a network of funders. My funders, climate was 6 or 7 in their top 10 things of what they funded. Post-pandemic, it went up to number 3. But where did health go? So how do you actually create that intersectionality between climate and health? How do you create that intersectionality between gender and health? Because if you look at it, a lot of the health issues fall on women and girls. So how do you actually create that intersectionality where investors are looking at it? Ajay, you talked about, the expense outside the wallet. I don't think it can be covered so much by public spending, because when you look at it, most governments right now are not able, especially in the countries that we are talking to, are not able to meet that funding gap. So how do we create an investment opportunity that actually brings in private sector capital to address some of this funding gap, especially when we're talking about health insurance, when we're talking about low-cost hospitals, when we're talking about access to healthcare that is priced for not the poorest of the poor, but just a little bit above.
We've had this conversation, and I'm really interested to hear where you are at when it comes to the private sector and de-risking investment, because we keep talking about the need to de-risk investment for the private sector and how philanthropy can help with that, but you have very rightly pointed out although there's a lot of money doing the rounds with philanthropic capital, it's not enough by any stretch of the imagination, even to address the issue of health and climate, let alone anything more than that. But when I speak to the private sector, I have to say, as much as there was ambition going into COP and some really good noise made coming out of COP, are we really seeing that private sector investment that says, okay, we can see where we can de-risk here, we're on it? Are we? You're seeing the beginnings of it, so I'll be more optimistic than not. You're seeing the beginnings of it. You're seeing a lot of interest in health and technology. You're seeing a lot of interest around looking at adaptation technologies, which is really needed in Asia. Less than 10% of any technology related to adaptation is actually is brought to Asia, and I'm sure even less to Africa. So you are seeing you're seeing interest from investors there. But to your point, Becky, about the de-risking, and here I'll ask a philosophical question: is it just philanthropy or philanthropic capital's role to de-risk it? Where does multilateral funding come in? Where does development finance come in? And I'd love to ask Ajay that question, is where do development finance institutions see their role in de-risking some of this investment so that we can bring in more private sector capital? Ajay.
So So there are two things. One is delivery of services, and one is financing, right? So we can be agnostic about who's delivering the services, whether it's public versus private. But when it comes to financing, there is no country that has made progress towards universal health coverage on the back of private financing. Let's not beat around the bush. It's always going to be public financing, especially for the poor. Public financing, broadly speaking, general taxation, social health insurance. No, not even private insurance. Globally, private insurance is what, 5% of the thing. So that's not an issue. The challenge here is that many countries, it's not rocket science. They're not spending enough on health, either because the size of the economy is not big, or the size of the government revenues are not big enough. In fact, many countries, IMF has a benchmark that at least you should have 15% of your GDP in taxes. Many countries don't even collect that much. So the private sector also has to pay their taxes, right? So, and also the share that goes to health. So, you can find out where your weaknesses are, and I can tell you where they are for India later. It's priority for health. Right? The government doesn't spend enough on health. In fact, we did see an increase in priority for health globally during COVID, and now in post-COVID, things are getting cut again. In real per capita terms, things are getting cut. So we also have to step up and make the case. We have to compete for scarce resources, just as other sectors do, and to make the case that health is not just a consumption, it's also an investment. We have a whole program at the World Bank, the Human Capital Project, that tries to make that connection. So it's not going to be easy, but we do need public financing, and where public financing is not available, to be augmented with external financing to the extent possible. But for a lot of lower middle-income countries, it's really domestic resource mobilization that needs to happen.
Domestic resource mobilization, Minister Chiponda. Where does that leave Malawi?
That's a very good one. In fact, I wanted to respond to World Bank. He made a statement about how do we make our financing climate smart. I thought that was a good one. So as Malawi, now what we have done in our new health sector strategic plan, first we're talking about integration. What we have done, we have integrated many services, and we are so grateful to our partners. I'll give an example, Global Fund. Initially, they were there to support us in terms of HIV management, tuberculosis, and malaria. That was the initial agreement, But now they have gone beyond because of the integration. We have said, as Malawi, we don't have enough. We have got so many challenges, but we have so little in our kit. So we have said, no, let's have one plan. Initially, it was looking at Global Fund looking at HIV at a disease, not at a person. But now we're saying, no, let's look at a person, not a disease. Because this person, you save her or him from HIV, they'll be doing very well, but then they'll get hypertension, and there's nobody supporting hypertension. And then because of some other issues, climate change, they'll have mental health issues. How do you support that? And then you have adolescent issues, you have family planning issues. So we have said, no, as Malawi, let's have one plan. Then all our partners, we work together, but following our plan. So that is what we are doing, and we're so grateful that all of them, they have understood to say, okay, let's have one plan, one budget. Global Fund will bring in 500-something US dollars. Rockefeller, whatever. Us as government, we also put in. We are also engaging private sector as well, so that they also do their part. Even Malawians citizens, we have some citizens that are doing very well. They also but have a part to play. So that is what we are encouraging, that all of us, let's just have one plan looking at a person. What are the person's needs? What is it that we need to do, to improve service delivery as we are turning to get to universal health coverage?
Can I ask you all, because I absolutely promised I would open the floor to questions, and I will. I just want to get your respective positions with regard what you hope to achieve in 2024 to drive concrete action. We're talking about the challenges that exist at the moment. And 2024, we hope, will be a year of concrete action if there is to be a lasting legacy from the from the UAE consensus. I'm going to thank you for staying, Adnan. I know you weren't expecting to do so, but thank you, because I'm going to come to you last, because I'm going to get you to kind of wind this up. So you're going to stay a little bit longer, if that's okay. Starting with you, Peter. What's the plan this year?
The plan has to be to build on the momentum that was created through COP28 and the leadership of the UAE to actually change the dynamic in terms of flow of funds and actual implementation of actions that mitigate the impact on the very poorest and most vulnerable. That has to be what we have to do, because otherwise we're going to sit there and watch people die. I just want to build on the point about de-risking. The way I'm looking at it at the moment is by neglect, we're re-risking the world, right? Because we're watching, first, we're not moving fast enough on climate mitigation, as Adnan was saying, but second, we're not moving fast enough to help those who are most impacted. And the reality is, these are some of the fastest growing, youngest populations in the world. The people are not going to just stay there and die. They're going to move. So we're going to see massive migration. That will lead to conflict. Well, the sort of knock-on impacts of those things, even parts of the world that are relatively stable and less affected, will be impacted by the migration. So that's the other thing I really want to see us grasp in this year is this is big, it's now, it's fast, and it's not going to sit neat. We can't say, oh, it's terribly unfortunate that Chad and Niger and countries like that are going to be nastily affected and horrible numbers of children. It's not going to stay there. I mean, it's bad enough that it's happening there. And I think we need that recognition of the sheer scale of what we're talking about.
Ajay.
My answer is going to be slightly more practical. So we have a portfolio of about 34 billion in health across 100 countries. And so, we've sort of made a commitment to make the climate co-benefits of that to increase to 45%. We're not there yet for health. I think the last couple of years it's around 32%, but the commitment is there to try and increase those co-benefits. And also we're doing some work in identifying what are some of the climate health best buys, what are the most cost-effective things you can do, and also to help countries systematically do what we are calling climate and health vulnerability assessments, trying to understand better where the risks are, also in terms of vulnerabilities of the health system's capacity to respond to those risks, and to sort of help in their planning and implementation process. Just some examples of things that are slated for this year.
Nina.
So I think keep building on sort of the awareness of the intersectionality between climate and health amongst social investors. I think build a shared understanding of the principles for financing these kinds of healthcare solutions using, the whole continuum of capital from philanthropic money to investment. And finally, I think to spotlight local innovative solutions and investable projects in Asia so that we really see capital move. I think it's very important that capital moves.
Can you give us a good example of that?
So I think it's interesting when you talked about share of wallet. The poorest of the poor spend the same percentage that anyone in this room spends on health and education. So if you're really looking at, it's not just the quantum, it's the quality that they get. So how do you actually invest in solutions that are providing quality at low cost prices? And that's what's important when you're seeing it, especially amongst large numbers of the urban poor across Asia. You will see that they go and spend on private healthcare, but they don't get the quality for their dollars. So you have now a number of investable opportunities that are really looking at quality at low cost prices. So that's an example.